Autism. Why have there been so many cases of autism spectrum disorder in the post-pandemic world? Understanding what autism is. Unfortunately, many people still have misguided and ableist views about the condition, which can lead to harmful stereotypes and discrimination. This is why it is very important to educate society about autism and clarify common misconceptions. According to the Statistical and Diagnostic Manual of Mental Disorders, autism is a neurodevelopmental disorder that brings difficulties in communication, social interaction, and deficits in socio-emotional reciprocity. Children with autism may present changes and delays in various areas of development, have difficulty sharing imaginative play, and present cognitive rigidity. Development milestones. According to the study Development Milestones, recognition of the signs of autism by early childhood education teachers, carried out by the pedagogue. To work with early childhood education, it is very important to know the set of skills that most children achieve at a certain age. Milestones help families and professionals understand when a child's development is not as expected and can be divided into socio-emotional, language, cognitive, and motor. The milestones are a good start to making education truly inclusive, respecting each child as a unique being and without assuming competence, as every child is capable of learning. It is up to the professional to seek resources to alleviate difficulties and highlight potential, stimulate skills for the development of autonomy, provide strategies for the child to learn, valuing the individual characteristics of each one, says Carla. The expert adds that there is not just one way to exist and acquire experiences. Children are diverse, and thinking that everyone is the same only makes differences unfeasible and can make it impossible for them to receive the necessary interventions for their development. It is still necessary to learn about neurodiversity, that there are neurodivergent people, and that we need to have more respect for differences, as there are different ways of seeing and conceiving the world. We are not all the same, and thinking like this will help us understand what diversity is, he concludes. For Brazilian neuroscientist Alison Arvmootri, professor at the medical school at the University of California in San Diego, USA, the new CDC numbers show that the prevalence of autism continues to rise, which we do not believe is something biological. In other words, it is, yes, an improvement in diagnosis, as autism has appeared more and is better known. It could be the same reality in every country in the world. After all, there is no evidence that this variability or that genetic mutations occur differently in other regions of the planet. In this aspect, what happens in the USA should be a representation of what happens in the rest of the world. He continued, another interesting part of the study is the increase in prevalence among minorities here in the US, such as Asians, Latinos, and blacks. This shows that the diagnosis is reaching these populations, which were being excluded and therefore appeared less in previous CDC data. Again, this relationship between minorities and diagnoses probably happens in other countries in the world, including Brazil, said Dr. Mootri. Men x women, 3.8 to 1. The gender divide in the prevalence of people diagnosed with autism continues to present a much higher number of men. The ratio of the study presented today is very close to previous years, at 3.8 men for every woman. In other words, varying from 3.2 to 4.3 among the 11 regions of the study. There are discussions about whether diagnostic criteria have always been aimed at the most common characteristics in males. Furthermore, they point out that female abilities to mask some signs of autism would indicate the possibility of different numbers of this gender ratio. It is worth remembering that the research points to people diagnosed with autism and not autistic people. In other words, access to formal medical diagnosis, whether for social reasons or aspects linked to gender, interferes with this result. Overall, the prevalence of autism in the 11 regions studied remains almost 4 times higher for boys. For example, the prevalence of 4.3% of men evaluated in the study than for girls, with 1.1% of women. Still, this is the first CDC report in which the prevalence of autism among 8-year-old girls exceeded 1%. TV presenter Marcos Mayan, father of an autistic person and well-known campaigner for the rights of autistic people, was also quick to express his disapproval. Let it be clear that autism is not a disease, Governor, and therefore there is no cure, he said. It is worth remembering that it was the Department of Health that indicated to the governor this lying, denialist response, which ends up influencing millions of people in a negative way. It goes directly against acceptance, which is what we fight so hard to achieve, he said. There is still time to go back on this decision, he appealed. Explosion of diagnostics. And there are more and more reasons to work to increase the acceptance of this group by Brazilian society. The Brazilian school census recorded a 280% increase in the number of students with ASD enrolled in public and private schools in the period between 2017 and 2021 alone. In Brazil, data from the World Health Organization suggests the existence of 2 million autistic people, but this estimate is considered outdated. A recent survey by the U.S. Center for Disease Control and Prevention showed that, if in the 1970s the number of ASD diagnoses was in the range of 1 in every 10,000 children, in 1995 it had already jumped to 1 in every 1,000 and continued to grow rapidly, until reaching 1 in 59 in 2018 and 1 in 44 according to a 2022 report. If this proportion is adapted to the Brazilian population, this would result in a contingent of more than 4 million people. While the number of diagnoses skyrockets, studies of the causes and characteristics of ASD have become a central theme in the area of neurodevelopment. The study of the neurobiological and psychocognitive mechanisms underlying symptoms has increased considerably in the last decade, as elucidating ASD is also a way of understanding how social behavior works, which makes the study of the disorder extremely relevant from the point of view of understanding the brain functioning. We now know that ASD is a multifactorial condition, that is, it involves a still unknown interaction between genetic and environmental factors. It is also established that it can present itself in different degrees, ranging from high-functioning ASD, marked by difficulties in social interaction, but which does not incur cognitive impairment, to more severe manifestations, which encompass, in addition to socialization problems, communication, and repetitive behaviors. However, regarding causal factors, there is still no established paradigm, and different hypotheses regarding the mechanisms involved in ASD are under discussion. Below, researchers from UNESP and other universities explain what these hypotheses are. Failure of sensory integration. This hypothesis is based on the high incidence observed of changes in sensory processing in individuals diagnosed with ASD. Sensory modulation disorder, difficulty for the CNS to regulate gradually and adapt it to the environment. The intensity, duration, and frequency of the response to sensory stimuli occurs in 5% to 16% of children between 6 and 11 years old in general, but, in the case of ASD, it is 40%, explains Andrea Misquiati, professor at the Department of Speech Therapy at the Faculty of Philosophy and Sciences at the UNESP campus in Morelia, coordinator of the Child Language Studies Laboratory, Lili. These changes consist of the way these individuals react to and seek sensory stimuli, visual, tactile, auditory, olfactory. According to Misquiati, individuals with these changes may be hyperresponsive, that is, with a low threshold of tolerance to sensory stimuli. They tend to respond exaggeratedly to sensory input, showing, for example, the defensive behaviors observed in many individuals with ASD, who tend to reject some textures, flavors, smells, noises. In hyperresponse, there is reduction or slowing. The threshold is high, that is, they may appear insensitive to pain, sounds, flavors, which gives the impression of limited sensory awareness. This shows itself in more apathetic, passive, low-engagement behaviors, making it difficult to initiate and maintain sensory interactions. They then tend to be lonely or not play, he says. There are also those who seek stimulation, on the other hand, with an excessively active motor profile. They run, fall, look for sounds. That's why they are labeled as impulsive, brutish, explains the researcher, highlighting that, often, deficiencies in the senses mask the symptoms of ASD, delaying the diagnosis and, thus, wasting time that would be important for some form of treatment to begin. Intervention. Currently, the researcher is conducting a case study of a 3-year-old child who, even after a hearing implant, did not respond to treatments with a speech therapist. The cause of the behavior was the fact that the child had ASD, that is, the lack of communication was not due to hearing. That's why it's important that parents and teachers receive information about how sensory issues can actually mask important symptoms of ASD, such as lack of eye contact, delays in language development and social interaction, says Misquiati. Genetics and environmental factors causing neuroinflammation. There are more than 1,000 genes already described as related to ASD. And yet, there are genetic variations within these genes, some already described in people with ASD and others not yet, of the same gene. So we still consider this a variant of unknown clinical significance, explains Patricia Braga, professor in the Department of Microbiology at the Institute of Biomedical Sciences, ICB, at the University of São Paulo, USP, and researcher at the Pasteur USP Scientific Platform. According to Braga, there are around 100 genes that are being described as strongly related to ASD, that is, a mutation in one of these genes is associated with a very high possibility of manifesting the disorder's phenotype. So, we can say that genetics is practically decisive in ASD, although there are still patients in whom, when genetic sequencing is carried out, the genes already described are not found, probably because other genes are yet to be described and also because there is a combination polygenic that can be determining whether or not autism manifests itself, he says. In this sense, whether or not symptoms manifest in individuals with a genetic predisposition, the issue of the interaction between genetics and the environment is greatly explored. Environmental factors can be diverse. The most described and considered important involve the occurrence, during pregnancy, of infections of viral or bacterial origin. These infections can induce immunological responses on the part of the mother that give rise to some reaction during the neurodevelopment of the fetus. This change in the fetus could later result in behaviors associated with ASD on the part of the child. This does not mean that any pregnant woman affected by an infection will necessarily have a child with ASD, as there must be a genetic predisposition for this. On the other hand, it is possible that there is a predisposition to ASD, but this predisposition does not manifest itself for some reason, which could be the environmental factor, intervention, says Braga. She explains that the result depends on the strength of the genetic factors involved. When there are strong genetic factors, even without environmental intervention, the child can develop ASD anyway. Hence the importance of exploring the relationship between environment and genetics, of mapping the most decisive genetic factors, as well as the most significant environmental factors that occur during pregnancy, says Braga. The list of environmental factors that are significant in determining the occurrence or not of ASD may include, for example, the trimester of pregnancy in which the infection occurs or the mother's response, called maternal immune activation. The substances that the mother's body produces to fight the infection can reach the fetus through the blood and, thus, cause changes that will later result in the ASD phenotype, explains Braga. Italian study finds new gene linked to rare cases of autism.